This is a procedure for patients who had an untraceptal myocardial infarction. They have usually typically an enlarged left ventricle and a reduced ejection fraction, typically below 45%. Functional heart failure class will be, in most cases, 3 or 4, but if the results will be as good as we hope, it will probably be a good idea to treat patients at an earlier stage, which means in heart failure class 2, before remodeling occurs. Obviously, medical therapy always comes first, then CRT, and then the ventricular restoration. We are talking about patients who had suffered from a large myocardial infarction, which resulted in chronic left heart failure. And so even if initially the scar caused by the infarction may be tolerated, we know from clinical experience and many long-term studies that the left ventricle will undergo some kind of remodeling, so that sooner or later the remaining myocardium will fail and heart failure symptoms will get worse. And we know that these patients will frequently be readmitted to the hospital, and that will be the case in more than 50% within 6 months. And also mortality is very high in these patients, so 1-year survival is only about 50%, which is worse than with most forms of cancer.